Have you been troubled with chronic, debilitating lower back pain for quite some time and have seen numerous different healthcare professionals, but unfortunately things are not improving? Maybe you've seen a surgeon and have been told that you need multiple levels in your spine fused because of multiple changes seen on your scans. Well, my name's Anthony Ghosh. I'm a consultant spinal neurosurgeon and founder of the Spine MDT, and I'm going to illustrate a case to show how using the skill sets of all the different professionals that deal with spine problems can help you minimize the extent of an operation that you may require. Wear and tear changes of the spine, otherwise known as degenerative changes, are very common. They're present throughout all age groups, and in this study that looked at people who do not suffer with back pain, who have had an MRI scan, demonstrates how common these changes are. Especially above the age of 50, 80% of patients, or people rather, without back pain will have degenerative discs or wear and tear in some of their discs. 14% of them will have a spondylolisthesis. That's where one bone slips forward relative to another bone. And I'll demonstrate that in the next case, but I've done a whole separate video on this. And as well as that, we see problems with facet joints, various changes throughout the spine in this age group and upwards. And that's in people who do not have any symptoms. This is why a very thorough assessment, i.e., clinical history, examination findings, and tying that all in with a good, accurate interpretation of your scan is really important in determining which one of these findings might be the pain generator over and above the other findings. So here we have an MRI scan of a lady who is 55, had chronic lower lumbar back pain, particularly worse on standing for a period of time or turning in bed at night. And her MRI scan here shows the front of the spine here, back of the spine. So this is a slice through the middle of the body. And these are the bones that make up the spine, the vertebrae. And you can probably appreciate this bone here has slipped forward relative to this bone here. And we call this a spondylolisthesis. I've done a whole separate video on this. Now, the disc above this level has darkened relative to the other discs, and this implies degenerative or wear and tear change in this disc. But as we've demonstrated, that in itself is very common in people who do not have pain. Now, this lady had undergone numerous treatments by osteopaths, chiropractors, and she'd done extensive core strength training with a physiotherapist for about 6 months or so, but no improvement. Now, there's quite common practice now to see a second level with minor changes, and if surgery is offered to fuse this segment, join it together to stabilize it, to include this level in the fusion, which is quite an extensive procedure. It's not unreasonable. It probably will help with the pain, but it's quite an extensive procedure, and then it limits the motion within this whole segment here. So she underwent an injection under my care, where we injected some local anesthetic and a bit of steroid to this level alone as a test. And that gave her significant improvement in her back pain for a short period of time. But it was able to help reinforce the notion that actually this is probably the biggest pain generator of the two. And therefore, with surgical intervention, given that the other treatments have failed, I decided to offer a single level fusion of this segment alone, but then work with my physiotherapy team to try and strengthen the spine, improve her posture or alignment of this, and help prevent this segment getting any worse. And here on the left, we have her x-ray 2 days after the surgery, and it shows again the front of the spine here, the back of the spine, and you can see the cage here. Now the alignment here is well maintained, hasn't changed, but this is only a couple of days after surgery, so we're not expecting much to change. But we can see the cage here at the front of the spine where I've fused the segment and realigned everything. You can still see this very steep slope here where I've drawn this line, how steep it is. And the worry that many surgeons would have is, can this fail? Should we have done 2 levels to help prevent that fail? So By using the help of a physiotherapy team and her engaging in a good 6 months of core strength training, stretching of the psoas muscles, the hip flexors, and strengthening her glute muscles, as well as a weight loss program with a nutritionist, we can see here 6 months later she's lost a bit of weight. You can see the soft tissue on the outside. This alignment has improved completely, and the level above has not lost its alignment. It's remained really stable, and she did really well. 6 months after surgery, she remained pain free. Now, as much as I love to operate as a surgeon, the point I'm trying to illustrate with this is that surgery alone isn't going to resolve everything. That's why it's important to have the skill sets of the various individuals that help treat spine disease to try and get that best result. But more importantly, minimize the extent of the operation you're going to need, and in some cases, in many cases, avoid surgery altogether. I really hope you found this video helpful. If so, please click the like button and do subscribe to the channel. Also, please feel free to visit us at spinemdt.com to see how we can help you. Thank you for watching.